fabulous. Um, this is great, and working with you on the publication was amazing as well. So this has been really interesting for me and for you. So my question is now that we have the manual, how do you see using this going forward in your practice?
Yeah, so as I alluded to in my presentation for clinical utility and future research, it the after with the edits, hopefully we can utilize this educational manual in programs or in the clinical setting to implement. So then it can kind of start initiating these conversations to address this gap where health professionals kind of lack the comfortability or even just like the skills or knowledge. So just promoting that in terms of like educating.
So do you have any specific ways you might incorporate using the manual in the clinic? Like,
Yeah, so I don't want to speak on behalf of other people's workspaces, but I know the first steps is going to start with me. So initiating like in services with my coworkers. At my work, they do offer opportunity to do in-service training. So also just promoting that, maybe having the educational manual available, but kind of just walking through step by step. Because rather than just saying, here is my big paper of things to look through, you kind of just want to provide a guide, provide pretty visuals that promote this skill set. So you can kind of encourage it to incorporate it in treatment.
okay, great. Um, and also again, so do you think you can use this? Because I know this is pretty specific for stroke and cognitive and communication deficits, but do you think this could be used for other populations or other diagnoses or so? What's your thought on that?
Yeah, so again, it depends on each client, and you want to just, as you know, in one of our sections, like understanding permission and consent, you just kind of want to make sure that it's appropriate topic for clients if they're interested. Maybe not today, but kind of bringing it up in the conversation that there is opportunity to discuss it later on in treatment sessions, continuing to build rapport, so then they're also comfortable to come to you with these kind of questions. Um, but also to answer your question, that it does not have to be specific for stroke. There are other diagnoses that can impact like cognition and also like communication, but it's kind of like establishes a general idea for health professionals to be able to utilize in practice to initiate these conversations, like to take these steps, including it in their care.
Okay, thank you.
Thank you
I
so much.
think,
Go ahead, Don.
no, go ahead, Dr. Mendonça.
No, I
You,
was going to call on you. So,
okay. Oh, okay. It looked like Dr. Mendonça was having a little bit of trouble with the chat. Looks like Lindsay has a question in the chat. Lindsay, do you want to mic and ask your question, or do you want me to read it?
I can read it.
Great.
First of all, so glad that you're doing this work. Really proud of you. My first question is, how do you envision this carrying over to other diagnoses or other impairments or disabilities? This work is so crucial, and I think something like this would be really beneficial for clinicians to have for multiple different impairments or disabilities.
Yeah, no, thank you. And your presentation was great too. I mean, even seeing your assessment too, I'm like, wow, how can I incorporate that in my manual too, right? Like collaborating with our colleagues. But going back to carrying it over to other diagnoses and impairments, specifically, I just focused on the stroke aspect. However, as OTs, we look at the person as a whole, right? So, it doesn't only have to be one diagnosis that we're addressing. Like it could include like their past medical history, other parts like including like body function, body structures. So we can identify these goals and take it step by step, prioritizing like what they want to do so they can continue to be participate in their like what's meaningful to them. We don't want to make assumptions just saying, hey, you just want to have sex again, right? But there's like a bigger picture and can still be carried over. I did create a table as well, just like in based off the interventions, but it could be carried over with other maybe if you notice like symptoms may be applicable to other diagnoses as well.
My second question was related to the OPISI.
Mhm.
As of right now, it's really the only evaluation tool that is more widely known. Um, but it's very extensive. There are three huge parts. There's the screening part, there's the performance part, there's the intervention part. Um, Within that tool, is there a specific part of that? It can be one of the subsections of the performance part, um, that you feel aligns best with this manual? Sorry, my dogs are barking.
That is a good question. In terms, I think like I wish I had the exact answer, but again, I feel like this is all very specific to a client. And even if they came to me and said, "Oh, I just want to be able to I want to be I want to engage, be intimate with my partner again," or this is kind of just providing the key constructs and like breaking down each definition and say, okay, what sounds more interested to you? Because I don't want to make the assumption that, oh, okay, like they want to do this, but just kind of like collaborating with the client as well as the partner to address like either like they want to expand their knowledge and like their sexual health, also their sexual activity, like being able to participate in it, sexual expression, but also if you don't know the answer, you always can always just refer them to somebody like who is the expert, but just to best support them in their recovery.
Thank you.
Hmm.
Sammy, quick question, because I have heard of the explicit model, but I have never heard of was it the OTSAF? Yeah. Can you tell me differences, similarities, or do they build on each other?
Yeah, so I think it was also Lindsay provided a diagram earlier in her presentation as well, just for time purposes, but the OTSAF also includes like a foundation built on the implicit model in terms of seeking permission throughout treatment sessions, but there are like components as well um, in the OTSAF that have it centered around the person and then it expands out to context. So we kind of like that's why it's based off of an OT perspective as well, like addressing these concerns. So it includes person, performance, occupation, and context to address sexuality and intimacy.
Great, great. Because sometimes it's interesting, right? In a manual to figure out how much versus how little to
Hmm.
to encourage people to use it. Because sometimes we put too much information in there and they never get to the important parts. So that's always a challenge with manual. But good job. That was amazing.
Yeah.
Congratulations, Sammy.
Thank you.
Uh,
Congratulations.
all right. So give me a second. All right. So we are going to move to our last, but definitely not least presenter of today. And I'd like to introduce Caroline Zemsky, whose capstone is titled Caregiver Support for Acquired Brain Injury, Strategies for Executive Function, Memory, and Attention. Dr. Glenn Gillen was Caroline's capstone mentor, but cannot be here today. And so I'm introducing Caroline on behalf of him, and Dr. Nielsen and I helped with getting Caroline through the last week. So just to introduce Caroline a little bit, Caroline is a Doctor of Occupational Therapy student at Columbia University, where she also earned her master's degree in occupational therapy. She holds a Bachelor's of Art in Psychology from New York University. At Columbia, Caroline served as a teaching assistant in neuroscience, was a student rep for the New York State Occupational Therapy Association, and received the Marguerite Abbott Memorial Award for Excellence in Physical Disabilities. She currently works at a pediatric clinic addressing sensory, motor, and self-care challenges, and she has been recently accepted to a position at New York Presbyterian Hospital on the Traumatic Brain Injury Unit, where she will rotate between the acute care and inpatient rehabilitation setting. She is passionate about neurorehabilitation and delivering evidence-based client care that promotes independence and enhances quality of life. Caroline, as you will see in her presentation today, completed several interlinked projects as part of her capstone project, which have come together really beautifully in a much needed manual for caregivers, and which I'm excited for you to hear about from her today. So, Caroline, I'm going to turn it over to you.
Thank you so much, Dr. Mendonça. And yeah, it was a good segue from Sammy's presentation into mine, I think. They're similar topics with manuals, and hopefully mine can, serve as a resource for those evidence-based strategies for cognition. So, hello everyone. I'm Carolyn Zemsky. The title of my presentation, as Dr. Mendoza said, is Caregiver Support for Acquired Brain Injury, Strategies for Perspective Memory, Attention, and Executive Functioning. So, my capstone was focused on creating a manual for caregivers of those with acquired brain injuries who are experiencing cognitive deficits, specifically in these three cognitive domains. So, a little bit of background. What exactly is an acquired brain injury? So, it's a brain injury that happens after birth. So, it can be a stroke, a traumatic brain injury, an infection, a tumor. And research shows that acquired brain injuries, or ABIs, as I may refer to it throughout this presentation, largely affect three cognitive areas, those being perspective memory, which is the ability to remember to do a task in the future, or the ability to remember, attention, and executive functioning. So, skills required in planning, initiation, organization, and problem solving. So, every year, about 64 to 74 million people worldwide are diagnosed with a traumatic brain injury, making it a leading cause of death and disability. And keep in mind that this is just one type of acquired brain injury, so it overall affects a very large and diverse population. So, when someone experiences an acquired brain injury, they often have a decline in functional independence, and it can bring about sudden changes that often place caregiver responsibilities onto family members or loved ones who can become caregivers overnight in these situations, and they may experience feelings of burnout, distress, isolation, and unmet personal and practical needs. So, that was a bit of background, but before I get into the actual work itself, I wanted to go through some of the work that supported project development throughout the doctorate program. So I developed my theory practice model, the occupational adaptation psychoeducational model. It combines ideals of occupational adaptation model, including a press for mastery and adaptive capacity, with a psychoeducational model highlighting management of symptoms, as well as education and support for the family or anyone involved with the rehabilitation process. My teaching philosophy really made me reflect on how best to create a manual for caregivers in a ways that is digestible for them. A systematic review brief definitely helped inform my evidence-based review of the literature. The continuing education course I took, titled Cognition and Executive Functioning to Enhance Participation, also helped inform my capstone by providing targeted resources on executive functioning. And my clinical residency took place at a pediatric clinic where I gained valuable experiences communicating with caregivers, offering recommendations and insights, and seeing how those strategies in the clinic carried over into the home and if they were effective. And the reflection of the doctoral process prompted me to think both professionally as well as personally about the entire process, how all those pieces came together, and it really made me recognize how each step contributed to the creation of my manual, how the experience has supported my overall growth as well. Okay, so my project overview. So this image chart details the actual process of my project and the development of the manual. So I completed an annotated bibliography review for those three essential cognitive domains that are typically impacted after an acquired brain injury, the perspective memory, attention, and executive functioning. That helped inform how we developed and organized the manual. I then took all the literature that I found, reviewed and detailed it into a review paper of how it could potentially help caregivers and why. And we will be submitting that to the Journal of Brain Sciences. And then I actually began development of the manual, taking all of that literature and those strategies, piecing it together to improve and manage those cognitive domains. And then I received feedback on the manual from experts in stroke and brain injury rehab and incorporated that to improve the manual. So some gaps in research. and rationale. So getting into the project and research itself now, I wanted to look at the research to determine if there actually is a need for caregiver support in this population. So the literature definitely acknowledged a need consistently, but it lacked practical tools and interventions to address it. A lot of the times it would just state, caregivers are burnt out and we need to help them, but didn't actually provide tools on how. So this highlighted a clear gap in available resources to actually support caregivers. And to address this gap, we chose to focus on strategy training rather than other burden reduction approaches such as promoting self-care strategies, exercise, healthy diet, because we wanted to directly support caregivers in their role by providing education and practical tools that could help them care for their family members or loved ones more effectively. Additionally, the literature also highlighted that strategy training is effective in reducing the impact of cognitive impairments following brain injury and also contributes to increased independence for survivors. So the purpose of this project is to combine strategies for perspective memory, attention, and executive functioning into one comprehensive resource, a manual for caregivers of individuals with acquired brain injury, focused on strategy training to promote cognitive and functional independence in the survivor. So the idea is that by giving caregivers clear guidance and practical tools that they can use, survivors will be able to function more independently, which not only supports their recovery, but also gives caregivers more time for themselves and hopefully reduces their stress and burden. So for the development of the manual, we use a systematic search strategy to find the best evidence-based resources to inform best practices. So based on the literature, we kept seeing memory, specifically perspective memory, come up, attention, as well as executive functioning as key areas affected after an acquired brain injury. And as stated prior, an annotated bibliography review was completed for each of the three cognitive domains to guide our methods and inform the creation and organization of the manual. So the results from that systematic search strategy will be given in three categories. So the chart here shows the studies and strategies used with regards to prospective memory. And most of the studies suggested common themes. So after completion of the literature review for prospective memory, the main themes found were use of external memory aids, such as using your phone for alarms, even utilizing Google Calendar for reminders and appointments, sticky notes, were all sorts of the external memory aids listed. Routine and repetition, so maintaining a consistent daily routine by keeping wake-up times, bedtimes, meal times, medication, all consistently at the same time every day. Environmental cues, helping connect everyday routines with tasks that need to be completed, and visual imagery. So after the literature review for attention, we found the key themes of metacognitive approaches, goal management training, and compensatory tools. The chart here also shows the studies we found for attention and the strategies detailed in each study. So a metacognitive approach is a technique that helps learners become more aware of their own thinking processes and how they learn. One of the strategies detailed was a stop, relax, refocus approach, in which individuals stop what they're doing, relax, take some deep breaths, and then refocus their attention on the task at hand and the next steps. Goal management training, just focusing on one goal at a time, reducing distractions and compensatory tools, using checklists, timers, reducing noise and clutter in the environment, breaking the task into smaller chunks. And then the literature review for executive functioning. The key themes here were time pressure management, problem-solving strategies, and again, goal management training. So the chart here details the studies and interventions used with executive functioning. So time pressure management was something novel to me, and it kept coming up in several studies. It basically helps processing speed and reaction time, leading to successful task performance. It's a four-step method to help individuals manage time pressures associated with a given task. They identify what can be completed prior to a task, how do you respond to unexpected and overwhelming changes, and developing an emergency plan to respond, how you would respond in these situations. Okay, so results. Based on what was found in the literature and those key themes that arose, we were able to design the manual. So these are two images showing a snippet of what it looks like. The title page on the left-hand side, the table of contents on the right. The digitation link to where it can be found is on the top left here. You can also email me for the download. And then the table of contents just shows how the manual was divided into those three cognitive domains, and then the strategies under those related to those specific cognitive areas. We also added additional resources because there were two primary strategies that in the literature contributed to overall cognitive functioning and rehabilitation, but it didn't specify a particular cognitive domain of like memory or attention. And then also the QR code for the manual references itself is on here, just to provide the references for all the strategies listed in the table of contents. Okay, so this just shows the before and after I received feedback from experts and incorporated into my manual. This is just a little sample. A summary of the main feedback I received was to add images. I was very text heavy, and the point of this is that we want it to make it easy, digestible, and a user-friendly interface. So I think adding images to break up large text sections was great feedback that I incorporated. Also, including definitions for less common words, rephrasing certain wording to align with an 8th grade universal reading level, and then adding citations on each page so users can easily reference the literature, see where the information and strategies are coming from on that specific page. So here is an example of what the manual looks like. This is the first couple of pages with regards to perspective memory. So it defines perspective memory because that's, not a common word, especially to people not in OT or healthcare. And it is the ability to remember to carry out tasks in the future, or simply put, the ability or remembering to remember. So this is just building out those key themes that I kept seeing in the literature. So using external memory aids, I broke it down into easy, digestible bullets for the user, added images relevant to the text. So putting a reminder in Google Calendar and setting that phone notification to remind them. Having a checklist. I know it's really small. The manual itself, it's bigger and it's nice to read, but the screenshots here are small just to fit. Having the checklist of when to brush your teeth in the morning, in the evening, taking the dog out for a walk, showering. And then I also have a image of a medication organizer, and it shows week 1, week 2, week 3, week 4, and medication for the morning and night, and the reference at the bottom for the supported literature. For our second strategy on the right-hand image, building out routines and repeating them daily helps manage perspective memory. So doing the same task at the same time every day. So we have a checklist pictured here, combining our external memory aids and building routines to manage wake up and bedtimes, as well as scheduled medication and meal times to support daily routines. And then the third strategy below shows the use of environmental cues. So using when-then statements, which literature defines as implementation intentions. And implementation intentions create a mental connection between a situation or a cue and the designated action. So for example, when I wake up, then I will brush my teeth. Or when I sit down for lunch, then I will take my medication. So over time, when the cue is present, the action becomes more automatic. Okay. So for limitations, so part of this work was to provide the manual as a preliminary support to fill the gap in resources. However, a limitation in designing this particular manual was that the manual was reviewed by a few experts to improve design and readability, ensuring there was no confusing terms or OT jargon, or if there was particular wording or phrasing that was essential that it was clearly defined. However, the manual has not gone through a robust feedback process focused on readability at this point in time. And then because our focus was on design and accessibility, utility testing or making sure the manual is doing what we set out to achieve is warranted to see if it actually does improve caregiver confidence and preparedness in their role. So for next steps and impacts, the intent was that we would contribute more resources for this population. So we've already made it into an online downloadable format for easy access. We're working towards distribution by putting it on Columbia's Academic Commons, which provides global access and discoverability to research produced at Columbia. We also hope that presentations like these and future in-services help raise awareness about the resource while we work on that further testing to ensure that it is effectively serving its intended purpose. And future studies are needed to gather more feedback on the manual itself. If it does in fact reduce the burden, if it's easy to use, does it have good utility in the setting? And here is a graph or a flow chart of what those next steps would be. So follow the caregiver as they use this manual in their daily life. So get real-time data, test effectiveness and the strategy and the usefulness. If they're adhering to the manual, is it easy to use? Also testing the manual's language, so actually putting it through a search engine optimization to analyze that readability, to make sure it is at a universal 8th grade reading level. And then also investigate if there are any changes in the caregiver burden. So maybe doing surveys and questionnaires on their quality of life, perceived support, confidence and preparedness in their role. If they know what to do when a situation arises, that sort of thing. And just overall data to see if the strategies support ABI survivors to be more independent and in turn reduce the time spent caregiving. So thank you. This here is a QR code attached to my references in the presentation for anyone who is interested. And before I wrap up, I just wanted to extend my sincerest thanks, even though he's not here right now, to Dr. Glenn Gillen for his support and guidance throughout the program. I'm also very, very grateful to Dr. Mendoza and Dr. Nilsson for their support and feedback throughout the process and stepping into a mentorship-like role for me. Thank you to Dr. Lang for her time, guidance, and input on my online portfolio, the digitation pages, and presentation preparation. Thank you to Dr. Geller, Dr. Marr, and Dr. Simon for taking the time to review the manual and provide expert feedback and input. And I would also like to thank my family for their support and encouragement throughout the program.
That was fantastic, Caroline. Great, great job. Since Dr. Gillen is not here, Dr. Nielsen and I will take that role of asking the first round of questions. So Dr. Nielsen, I'll open it up to you first.
Sure. Thank you for that wonderful presentation. It's very important work that you're doing here, filling a gap. So this is so needed. And you talked to us about how you decided on strategy, training, and really focusing on that for reducing caregiver burden. And you're now going to be moving into a position at NYP where you have access to the population that you're interested in. And I'm wondering, what are your next steps specifically related to the manual now that you have this position at NYP?
Yeah, it's a great question. And I think it's great that I'm stepping into this role of where I want to be and where I can actually put this manual into action directly with caregivers or people who are overseeing, patients I may interact with. So I think next steps would be making known that this exists. So, having an easy link, maybe once it's on, I could show the digitation, but maybe once it's on the academic commons, um, giving the link to all the caregivers just to show the education and the resource there. Um, and, maybe even in an inpatient rehab setting, providing some of those strategies with the caregiver alongside me, educating them, showing them how to do it. Um, having having them do it alongside me, seeing if they have any questions before going home and feeling comfortable doing it themselves. So, yeah, I think it will be great, and I'm very excited about the next steps.
Yeah, I think that that's a great possibility to do that strategy training with the client and have the caregiver involved in that, and then
Hmm.
provide the manual and then follow that over time. That sounds like a wonderful step in the right direction. So
Hmm.
that's
Yeah.
all I have. I'll turn it over to Dr. Mendonça.
Fabulous job, Caroline. And, there's evidently a lot of work that went into this, right? This is very literature involved, very informed, very evidence-based practice informed. As you were developing this, I have two questions. One, what were your biggest challenges as you were trying to put this together, right? Because there's so much information.
Hmm.
As you were looking at the literature, did you feel like there was anything missing? Because this is very literature informed. Was
Hmm.
there anything in the literature that you feel was not addressed?
Hmm.
You couldn't put in the manual potentially now, but might be something to think about in the future as you gain more, experience in this area.
Right. Okay, so to answer your first question, what was most challenging is, yeah, very research heavy. So a lot of time and a lot of hours spent just combing through research. And in the beginning, I was struggling with finding good resources, but as I found better and better informed practices that actually supported, effectiveness and improvement, I would then look at the, references detailed in those studies and like kind of go through down a rabbit hole of getting all the references. So definitely just trying to organize and find those, I think was the biggest challenge. And also at a certain point, it's like, when do you stop looking for those references? Because they can keep going and keep going. And I think after, I found the key themes and the key ideas that I kept seeing in the research, I was like, okay, I think it's good to stop here. I have a lot of resources. I think I don't need to keep looking for more, but I think that was definitely the biggest challenge. And then something that I think was missing, just the first thought that popped into my head was, so for memory, in the literature, I found that specifically perspective memory is something that is affected in acquired brain injury survivors. And executive functioning, it includes processing and problem solving, all those. With attention, there's different forms of attention, right? Like selected, sustained, divided attention. And not many of the resources I found actually like divvied up the attention and said which strategies helping which
Mm.
component of attention. It kind of just labeled attention as a whole and said, oh, this, improves attention regulation or attention processing, but it didn't actually, define what component of attention. So yeah, that I found surprising. I think there was one study I found that actually sectioned out those attention um, components and said what percentage is affected after.
Mhm.
But yeah, with regards to the strategies focused on different attention components that I found surprising.
So that's great, right? So with everything else you have in your bucket right now, that's another thing you can
Right.
do as you're leading and intervening with clients, something that you keep in the back of your mind to see what's working or not, right? That's how we
Mhm.
learn. That's how we create evidence. So fantastic. Um, I know Dr. Mar is driving, but she had a question.
Okay, can you hear me?
Yes.
Yes.
Okay, great. Caroline, I just wanted to say that was a wonderful, wonderful presentation. And I was so impressed with your manual. I just wanted to get on to comment to say, follow through with it. Follow through with your plan, because I think it's so important that caregivers get the information that you've put together there and that you research. So great job. I just wanted to go on and say that. And I also wanted to say to the other presenters, because I haven't been able to type, excellent. I've been so impressed with everybody's presentation today. It was wonderful. Thank you.
Thank you. I appreciate that. I will actually add that when I was interviewing for the job that I accepted, I mentioned my capstone project because it is a TBI unit, and they were very interested and were interested in taking next steps and, following it as it goes. So very exciting and very hopeful.
That's amazing. That's exactly what we want to happen, right? With these projects. They shouldn't end today. Today should just be the beginning of all the work you're doing. Dr. Simon, go ahead.
Yeah, great job, Caroline. This is obviously, a topic that's near and dear to my heart. And I'm just wondering, as you were reviewing the literature, there's a lot to be said between having worked a lot with psychology and neuropsychologists and, having the OT influence and the impact of this on function and occupation based. And if you found like in the literature, was that something that was missing, or did you have sort of like a framework, or do you see something like that in the future? Because that is the crux of it. We see this all the time. So just wondering what your thoughts were.
Yeah, no, that's a great point. I definitely see it in the future, but I did see it in the literature. A lot of studies noting that strategy training and these specific interventions alongside pharmacological interventions combined together, promote an even greater increase in cognitive functioning. So I definitely saw it. I just, didn't include those because I didn't want to focus on pharmacological at all, just because I wanted them to be, practical and actually able to implement for, the common caregiver at home. But definitely saw it and definitely saw that when combined, it can produce an even greater effect.
Right. I think I meant like more like there's a lot of paper and pencil strategies, and there's, psychology has, it's almost like that functional cognition model
Yeah.
and how it sort of plays out. And luckily there are like OT codes now, right, for functional cognition, or it falls under it. So it'll be great to see where you take this moving forward in your new position. Congratulations. And um, it's really, really important, and caregivers are the ones who are there to help support it. So kudos to you. This is going to be really helpful to practitioners and to patients and to their caregivers and their support teams. So good luck.
Thank you so much.
Fantastic.
To help you
Go
and
ahead.
guide you in further study development when you're implementing this at NYP. So don't hesitate to reach out.
Yep.
Definitely. Sounds good. Thank you.
Is it okay if I make a comment?
Yes, go ahead.
Hi. So great presentation. And I just thought it was so interesting reading your manual and then kind of thinking about the work that I did with Dr. Wong on our manual, and a lot about the cognitive components and strategies. A lot of your strategies that I read were similar strategies we did for sexuality and stroke. So, I just thought it was a really nice compliment. Maybe our manual can be used in your area too at
Definitely.
NYU.
Yeah.
Try to, maybe combine, or not combine, but definitely bring that in as well.
Part 1 and part 2. Yeah.
One and part 2, different areas. But
Yeah.
I also just found it interesting when I was looking at the literature for stroke, sexuality, and cognition. They talked about everything else. They talked about physical impairments. They talked about pharmacological. They talked about psychological.
Yeah.
Very limited information about cognition. Very limited. So it was more of a comment, and great work, and congrats. And I'm happy to see where you go with this.
Thank you. I appreciate it.
Right, fantastic. And that brings us to the end of our capstone presentations today. What a fantastic day. So I just want to first of all begin with congratulating all our 9 fantastic students today. So Dr. O'Neill, Dr. Novakovic, Dr. Rosiska, Dr. Cohen, Dr. Hopkins, Dr. Jankowski, Dr. Legros, Dr. Wong, and Dr. Zemsky. What an amazing accomplishment. And you have really made us proud. So I think I speak for all of our faculty, for our program, when we say we are so proud of you and so happy to have had you first in this program and then to see all the wonderful work you have done and presented today. I don't think we see the intensity of it throughout the program because you're working with your mentor, but seeing this at the end, it's just so obvious how much work you've put into it, and you should be really, really proud of yourself. We want you to keep in touch. We want to continue to see all the amazing work you're doing. And we know this is not the end. Like I said before, I think this is the beginning of some very significant work that you're going to do in your careers. And, we're proud to say it began here. So that makes us really proud. I'm going to put a pitch for don't let this end here. Go out there and present this at conferences. You're building the evidence. Everything you talked about today in terms of saying there is no evidence or there isn't enough out there, you've built it. And so you want people out there to be seeing it. So go and present, whether it's locally, nationally, internationally, take those opportunities and disseminate your work. So I now want to open it up to the faculty, to all our friends over here, to all our colleagues, to congratulate our students and say anything you want to say.
I just want to congratulate everyone. Wonderful, wonderful presentations, amazing work. As Dr. Mendonça said, needs to be continued, disseminated, really fantastic. And I can remember welcoming all of you at orientation, and now to see you all here, it's just really incredible. So congratulations again to all of our doctors, and go out and celebrate.
And now I am putting on a different hat now, and Dr. Lang is here as well, and Dr. Mahoney, I'm sure, would be here. But as alumnus of the CU OTD program, we want to welcome you to the alumni. Dr. Lang, if you want to, I was going to message you saying that I don't know if she's frozen or something, but congratulations. I attest to what both Dr. Mendonça and Dr. Nilsson. It's amazing to watch your journeys and just seeing you, knowing I've seen many of you sitting across my desk and a little bit of disarray sometimes with fieldwork concerns, but just to see the absolute amazing work that you've all had done. I'm like so proud of all of you and can't wait to collaborate and see where you're all going with this. So congrats.
I was going to say the same thing. I see you in your first year, and it's just amazing to see everything that you've done by then and all the way up until now, and all the things that I know that you're going to continue with. So congratulations. Really proud of you. I'm sure everyone is proud of you, and, go forth and be productive.
I want to say congratulations to each of you. I too have watched you come over your nerves in orientation and had you the first 3 semesters on campus at CUOT. And I'm so proud and honored to be a part of your learning journey, especially in the beginning, and some of you mentored throughout. So just proud and congratulations. And I can't wait to see what's next for you all.
I will ditto that. Congratulations, everyone. We're so, so proud to see your growth and, just the beginning of your journey. I'm sure we're going to see wonderful things from each one of you, and just continue. Keep on doing the projects and the work that you've been doing. It's amazing. Thank you.
Just want to take my turn and congratulate everyone for this amazing day. This was like a conference to me, and I've learned a lot, and it's not surprising. I'm just going to say that I'm grateful for learning from you, for working for you. This is a cohort that did with me the service learning project up in Ithaca. And knowing you then and very intimate in those transfers and whatnot, and seeing you now being at the forefront of change, I have no. Keep in touch. Let us know how we can help and collaborate. Thank you all for being such an amazing.
Yeah. I'd like to say the same, probably what everyone else is saying. Congratulations on everything. Your presentations were amazing. You guys were great in my class, so it was a pleasure being with you and having those discussions in class. So congratulations, and definitely keep in touch. Um, we'd love to hear what you're doing and collaborate with you going forward. If you need our support, we'd be, I guess I'm talking for myself, but I'm sure I'm talking for all faculty here. So thank you very much.
Now that you're all doctors, I can call my colleagues by their first name in front of you. So I just wanted to congratulate all the mentors and all their hard work that worked with you. And also Dr. Mendonça, this was an amazing day. And well, I'll say Rochelle and then Dawn, thank you for everything that you've done. These just keep getting better and better every year. They're just amazing. So congratulations to everyone.
I also wanted to share my congratulations. It's really great to see all of this come full circle. I'm here at the beginning, seeing the project start to develop, and I'm just very grateful to be a part of it. It keeps me excited to be in the know of what's going on, and congratulations to everyone. It's really amazing.
I'd actually like to make a plug to Rochelle as well. Great, great work.
Oh.
I know this is this is being director is a lot of work and a lot of time commitment. And again, I just want to say thank you because you've helped me with my mentorship. So you've mentored me. So again, thank you so much for your support. And you did a great job putting this all together.
Thank you all. All of you on here make it easy. So, the students and the faculty, we could never do it without you. So congratulations. And I know you all probably just want to go and lay in bed right now or go and get a drink maybe. So go and do both, either or, and get some rest. You deserve it. You've worked really hard, and have a wonderful weekend and rest of the summer.
Thank you.